Hi there, my name is Meki Dizon. I'm a third-year nursing student and I'm going to be demonstrating how to do a chest tube dressing change. So I already checked my physician's order and I know that there is an order for a chest tube dressing change for my patient. And I already know my patient, so I know that my patient does have a chest tube. And I already asked him beforehand if he wanted any pain meds for this, and he said that the procedure normally doesn't hurt, so he doesn't need any. So I'm going to gather my supplies now and I'm going to go into my patient's room. As I enter my patient's room, I'm going to do my hand hygiene and I'm going to do an entrance safety check. So there are no environmental hazards present. My patient is non-distressed. Call bell light is within reach. Bed is at its lowest level. Hi, I'm Mikey. I'm your student nurse for today. I'm here to do a chest tube dressing change on you. Can I just look at your wristband? Can you say your name for me and your birthday? Do you have any allergies? No? Okay, so that's perfect. So for today, I'm going to be doing a chest tube dressing change on you. So basically, I'm going to remove your old dressing. I'm going to be assessing the site for any infections or subcutaneous emphysema. And then I'm going to be cleaning the site with normal saline and applying new dressing. Do you have any questions? Are you still okay with me doing this procedure? You're still okay with it? Okay, so that's perfect. So now I'm going to assist my patient in a semi-Fowler's position. I'm going to be moving his bed up to about my waist level. And I'm going to make sure that the side is exposed. I'm going to move my bedside table to my waist level as well. Okay, and now I have my dressing tray here. It is sterile, it's new, it hasn't been opened yet, and it is intact. So this is what I'm going to be using. I'm gonna do my hand hygiene first, and then we're going to start setting up our tray. Okay, so I'm going to open this in an aseptic manner, making sure that I don't contaminate it. Okay. Then I'm going to pass myself this garbage bag. I'm going to take note of my 1-inch border so I don't contaminate my field. And I'm going to be asking my patient if it's okay if I put this at the edge of his bed. And he said that it's fine, so that's where I'm going to put it. Okay, I'm going to pass myself this drape. I'm only going to touch the 1-inch border. I'm going to put it near my patient's insertion site. Okay. And now I'm going to be adding in my supplies. So I have Gelanet over here. So this is an occlusive dressing, and its purpose is that it basically occludes my patient's chest tube insertion site so that air doesn't re-enter the intrapleural cavity so that we don't get any pneumothorax. So I'm going to open it in an aseptic manner. Okay, and we're going to be getting our Gelanet now. Making sure that it doesn't flap back. Okay. And we're going to be putting this in our garbage. We're going to add our 4x4s. And we're flapping back the wings so that we don't accidentally contaminate the gauze. Okay, and we're adding our drain sponges now. I'm going to flap this back. Okay. All right. And I think we're good with that. Okay, so now we're going to be adding in our normal saline. So this is brand new, it's sterile, it hasn't been used, and it's not expired as well. So we're going to be adding in some normal saline to our tray. I'm going to be doing it carefully. Okay. And now that we have our tray set up, I'm going to be doing my hand hygiene now, and I'm going to be applying my clean gloves. So now I'm going to be removing my patient's old dressing. So I'm going to do this carefully so it won't hurt as much. Okay. I'm going to remove this. I'm going to stabilize over here so I don't accidentally pull on my patient's dressing, chest tube. Okay, so I'm going to assess my dressing now. Looks like there's no exudates or drainage, and I see no blood as well, and there's no odor, so it looks like there's no complications. It doesn't look like there's any infections. So I'm gonna document those in my assessment later. Okay, and I'm going to be using my forceps to remove this old gelinette. I'm gonna discard both of that, and I'm going to assess my patient's site. So I see that there's no redness, no swelling. I'm gonna feel for it. Looks like there's no subcutaneous emphysema either, so no infections noted. So I'm going to be documenting all of those in my wound assessment or my IPM sheet later. I'm going to discard my dirty gloves now, and I'm going to do my hand hygiene, and I'm ready to put on my sterile gloves. Okay. Okay, so now that we're sterile, we can only touch sterile items, and my hands must remain above my waist at all times. I'm just going to be fixing my site for my dressings first. Okay, so I'm going to be grabbing my forceps. Okay, and I'm going to start cleaning my patient's wound now. I'm going to take note of my 1-inch border, making sure that this is not touching it. Okay, I'm going to wet it with my normal saline, and I'm going to be cleaning it from site to the outer, and I'm going to clean it in a circular motion, just one swipe each one. Okay, another one. Another one. Okay. And now we're going to be cleaning my patient's chest tube. Okay, I'm going to be cleaning it. Alright, and we're going to be cleaning the underneath area of the chest tube as well. Okay. Alright, now we're going to dry it. I'm going to be using my 2x2s. Okay, and we're going to dry in the circular motion as well. One swipe for each gauze. Okay, it should be dry now, so I'll be drying my chest tube now. Okay, and now that that's dry, I'm ready to apply my gelinette now. Okay, so I have my gelinette over here. So like I said earlier, the purpose of this is so that it occludes my chest tube opening so that air doesn't re-enter the intrapleural cavity, so that we don't get any pneumothorax. So I'm going to be applying this, making sure I don't touch my patient's chest tube or the site, and that it's occluding my insertion site well. Okay, so it looks like it's fully occluding it now. So we're going to be applying our IV drain sponges. So there's 2 over here. Okay, so we're going to apply our drain sponges now. Okay, and we have another one, and we're going to put this in a different direction. Okay. Okay, so that's good, and we're going to be applying 2 4x4s now. Okay, then now I am no longer sterile, so I'm going to be applying my MeFix now. So I'm going to be applying my MeFix. Okay. Okay, we're going to grab another one. And I'm going to make sure that I tent it over here, so in case there is any pulling, it doesn't pull in the chest tube and it pulls on the dressing instead. Okay, and I see that it's fully occlusive, so that's good. All right, so now I'm going to ask my patient, does it feel comfortable? Is it okay? Do you have any concerns? No? Okay, so that's good. So I'm going to be assisting my patient in a comfortable position, and I'm going to be giving them the call the light if they need anything. And I'm going to be cleaning up my supplies now, and I'm going to document all of this. So that includes my wound assessment and that I did the dressing change on my either my IPN or my wound assessment sheet. And I'm going to be doing an exit safety check. So there are no environmental hazards present. My patient is non-distressed. Call by light is within reach. Bed is at its lowest level.